So, before we get started with the first learning point of this session, we would like to start with a pre-assessment survey. This survey is to assess what you already know about addiction. It is in a true/false format, so it isn't difficult to take, and it'll only be used to gauge how effective this program is. The way that we will gauge how effective this program is by giving you guys this pre-assessment survey and then a post-assessment survey. And then the answers from the pre and post-assessment will be compared between the two to see if you actually taken away anything from this program. We will be giving you all a minute or two to complete the survey, and then we will begin. You can start now. Okay, time is up. And now we will begin with our first learning point for this session. So, when you hear the word addiction, what are some things that you would typically hear from other people or some things that may come to your mind? I'll take the question over here. I'll take the answer over here. That's a good answer. I'll take another one. That's a good answer as well. And I'll take one more. I see how you got to that answer. So here's what I came up with here's what I came up with some answer that some people may have. So addiction could be using drugs or alcohol is a choice. So if someone gets addicted, it is their fault. Addiction mostly affects certain types of people. Or addiction is treated behaviorally, so it must be a behavioral problem, not a disease. Or prescription drugs are not addictive like street drugs because they come from a doctor. But what really is addiction? Because in order to implement the best treatment for something, you have to truly understand what it is. So let's take a look at what addiction actually is. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. Addiction is a complex condition where there is an uncontrolled use of a substance despite the consequences that may occur. Addiction can also be a chronic dysfunction of the brain system that involves reward, motivation, and memory. So we just learned about the textbook definitions of addiction, but let's break it down even further because sometimes textbook definitions can go over our head. So that means that addiction is unpredictable. It can happen to anyone. It is treatable, and it is a chronic medical disease, primarily a chronic dysfunction of the brain system. So now that we identify what addiction actually is, let's look at how someone can become addicted. Repeated substance use can cause changes in how the brain is structured and how the brain functions. These changes can last long after the immediate effects of the substance wears off. The changes in the brain structure and function are what causes people to have the intense cravings, personality changes, abnormal movements, and other behaviors. Addictive drugs can release 2 to 10 times the amount of dopamine that natural rewards do, and they do it more quickly and more reliably. This can cause the brain receptors to become overwhelmed. The brain responds by producing less dopamine or eliminating dopamine receptors. This is the equivalent to turning the volume down on a loudspeaker when the noise becomes too loud. As a result, dopamine has less impact on the brain's reward center. The reward circuit in the brain includes areas involved with motivation and memory as well as with pleasure. Addictive substances and behaviors also stimulate the same circuit and then overload it. So in time, the desired substance can no longer give as much pleasure, meaning they must take more of it to obtain the same dopamine high because their brains have adapted or built up a tolerance. Repeated exposure to an addictive substance causes nerve cells in the area of the brain involved in planning and executing tasks to communicate in a way that turns liking something into wanting it. The pleasure associated with an addictive drug or behavior subsides, but the memory of the desired effect and the need to recreate it persists. The hippocampus and the amygdala store information about environmental cues associated with the desired substance so that it can be located again. These memories help create intense cravings whenever the person encounters those environmental cues. The cravings not only contribute to addiction, but to relapse after a hard-won sobriety. An example of this is a person addicted to heroin. They may be in danger of relapse when they see a hypodermic needle. Conditioned learning helps explain why people who develop an addiction risk relapse even after years of abstinence. So, what's the bigger picture? Addiction involves craving for something intensely, loss of control over its use, and continuing involvement with it despite adverse consequences. Addiction exerts a long and powerful influence on the brain that causes cravings for the object of addiction, loss of control over its use, and continuing involvement with it despite adverse consequences. No one intends to develop an addiction. The brain goes through a series of changes, beginning with the recognition of pleasure and ending with a drive towards compulsive behavior. Some addiction statistics. 40 million Americans ages 12 and older have substance abuse problems. Addiction and substance abuse affect more Americans than heart disease, diabetes, or cancer. 59 million, or 21.4% of people 12 and over have used illegal drugs or misused prescription drugs within the last year. 25.4% of illegal drug users have a drug disorder. 22% of males and 17% of females used illegal drugs or misused prescription drugs within the last year. 70% of users who try an illegal drug before age 13 develop a substance abuse disorder within the next 7 years, compared to 27% of those who try an illegal drug after 17. The earlier substance use starts, the greater the risk of addiction. Persons previously abusing drugs and recently released from prison are at the highest risk of overdose, as their tolerance to the drug has dropped while being incarcerated. And specifically, Pennsylvania's rate of overdose is 42.4 deaths per 100,000 people. Some addiction facts. Addiction is a developmental disease. More than 90% of people with a substance problem begin smoking, drinking, or using other drugs before age 18. More than 96% begin using the substance before the age of 21. 7 in 10 people with the chronic diseases of high blood pressure, major depression, and diabetes receive treatment, but only 1 in 10 people who need treatment for substance problems receive any form of care. Of those who do receive treatment, most do not receive anything that approximates evidence-based care. And addiction, substance use, and abuse are the largest preventable and most costly health-facing problems and the most costly health problems facing the USA today, responsible for more than 20% of the deaths in the US. Addiction, substance use, and abuse can contribute to a wide range of costly social consequences, including crime, accidents, suicide, child neglect and abuse, family dysfunction, unintended pregnancies, and lost work productivity. Of every dollar state and federal governments spend on substance program problems, only 2 cents goes to prevention and treatment, while 96 cents pays for the consequences of our failure to prevent and treat this problem. Addiction can be prevented and treated using a wide range of evidence-based screening, intervention, and treatment tools and practices. Now, I know that was a lot to learn in a little bit of time, but I do want you guys to take a minute to reflect. Take a minute to think about what you just learned about addiction. Acknowledge any perceived feelings or vulnerabilities to addiction that may have arisen, and also acknowledge any perceived feelings on leaving addiction untreated. It's okay if nothing comes up for you. It's okay if your feelings about addiction is the same as before you learned this new information. But I do want to give you all a minute to reflect on what you just learned before we start the second learning point. Now, let's get into our second learning point.